I'm Adam Estoclet, professional hockey player in Sweden, and I guess I'm four and a half months into my post-concussion symptoms happening now. I grew up in Minnesota, so I've been playing hockey since I was 3. Went to Dartmouth College for 4 years after, and then I played 2 years pro in North America for Calgary's farm team, and this is my 3rd year playing professionally in Europe. It was actually the week before my first game this year in Sweden. I kind of got a shoulder to the jaw. Wasn't actually that big of a hit, but I went down and kind of had trouble getting up, sort of deal, which I obviously thought was strange. But then, following the hit, I skated away, and the next day just kind of felt, a little out of it, kind of tunnel vision, super tired, and I actually played a game the next day, which looking back probably wasn't very smart. And then just the following, nothing bad happened, but the following 4 days, just symptoms started coming. Sensitivity to noise, my ears were so sensitive, my eyes were so sensitive to light, I was so tired, trouble with memory, bad tunnel vision. So then I stopped playing and just, rested until, pretty much what most people tell you is a rest until you start feeling better. So I was like 4 weeks in, still feeling terrible. I had my windows boarded up because I couldn't have light in. Like, I was in my apartment the whole time, just like not feeling good. So obviously this isn't like something that you just like look in the white pages for, it's kind of an interesting thing. And there's a lot of neurologists. I probably talked to like 3 or 4 that were just like, a concussion symptoms can last a week or they can last a year. No one really knows much right now. So you have to kind of just wait it out and see. And I've already been waiting for 3 months. So what I would say to all of them is can I start being a little bit more proactive here and doing something? And so I talked to my old neurologist at Dartmouth, and he's like, go to Dr. Kutcher. He's like, he's worked with so many people that are in the NHL right now. He's worked with so many hockey players that, have trouble with concussions, and he's gotten people back. I actually emailed him Friday night at 6 p.m. and he responded to me at 6:20 p.m., which was I was obviously so excited. I've seen neurologists that, touch my face and asked me if I could feel it, and I said yes, and they told me I'm fine.
So I first met Adam and came to our clinic. He was actually feeling quite bad that day. And I think in retrospect, a lot of it had to do with his anxiety regarding his problems. I think he understood that he had been having symptoms for far too long, and he really wanted to get better. With all of our patients, the initial visit is very, very important to set expectations of how much we're invested in your care, in doing a comprehensive evaluation. And so we spent a lot of time talking, doing an examination, gathering information about not just his most recent injury, but previous injuries, his hockey career, his medical aspects of things outside of playing hockey. And so that takes a good bit of time. And so that first visit, we spent 2 to 3 hours together going over every aspect of his neurological health.
So we started off just at the clinic, at the core clinic, and started off kind of just doing balancing drills with eye drills, get my heart rate up, and then I never knew my heart rate could get so high without moving that much. So we've done some pretty cool things. I've been on the other side of Bosu balls, balancing with weights in my hands and getting told it's kind of a brain, I guess it would be almost described as a multitasking deal. So, he's reading out instructions to me while I'm balancing on a ball and doing weights, while also trying to stimulate my eyes with stuff in the background, trying to reconnect the cords. One of the things you guys saw that's pretty cool is doing the ping pong. Where I'm on the electronic surfboard or on the Bosu ball, and the ping pong ball is kind of flying, and becomes at 100 a minute he gets it up to. And then also, NHL games playing in the background and just more multitasking stuff. So gym-wise, I think that's been good, kind of get my heart rate up while also stimulating my brain.
So one of the things we do right off the bat when we start evaluating our patients, whether it's concussion or post-concussion syndrome, like in the case of Adam, is we understand that the neurological system will behave and perform in one way when it's at rest, and then if you challenge it, if you challenge a person to do physical tasks and cognitive tasks, you can see things in that examination that can give you clues as to what things are really bothering the patient and what's the best way forward. So we always start with a very simple type of exertion, such as a stationary bike or a treadmill, but then based on the history, the examination, and really how that first exertion goes, we will then start doing other types of exertion that challenge the brain in different ways. The whole time evaluating the person's performance and examination to get a clear sense of what is really at the core of the problem. One of the things that we have found over the years when it comes to dealing with athletes specifically is that the sport matters to them in ways that's more than just it's a hobby they do or it's something that takes up their time. It really is a part of them. And when they're injured doing their sport, and all these symptoms are part of what's keeping them from playing their sport, many times it's extremely helpful to get them in that sporting environment and evaluate them doing the things that they have been doing their entire life. And so with Adam, much like we do with all of our patients, is we simulate the sport that they play, and even to the point of taking them on the ice. I skate with him, and we do drills together, and we interact together, and I do an evaluation, examination, during hockey-related drills. And he's at a stage now that is very simple, where all we're doing is very simple drills. He and I interacting with an athletic trainer. As he continues to recover, those drills will become more complex. We will add more challenges to him that are adding to basically the environment to get it as close as possible to actually playing hockey. That's what that recovery process is all about, and there's no replacement for actually doing that in the sporting environment. You can't simulate that in a gym.
If I'm just alone going and skating, I'll probably go skate for 10 minutes and be like, oh, I feel like crap, I should stop. But just like having Dr. Kutcher there being like, hey, this is gonna be hard, but you have to push through it sort of deal. It's just like, it's so nice to have someone telling you, what you need to do to get better. It's very easy, especially for a professional hockey player, to say, see this guy right here that plays in the NHL, he was where you were 5 months ago, and now he's playing in the NHL every day. This is what he did with me, and I got him to back playing, so do you want to do it? Sort of deal. It's like, yeah, of course.
So I would say for the next several weeks, we'll be working closely together to continue his recovery. And that will look like several visits that occur on a weekly or twice a week basis, both in our clinic, where in the indoor gym environment we can do several different evaluation types and work with different aspects of his recovery, but then also continue on the ice. And we will add layers of complexity. We will add the number of people who are on the ice interacting with him. We have an excellent network of former professional hockey players in the area who love to help out patients like Adam. But we will get on the ice, and these are people who are actual hockey players and not neurologists who used to be hockey players. And so that really provides us the ability to simulate a lot more game-related activity. It's all about having him be exposed to the rigors of ice hockey in a safe manner before we ever allow him to play in a live game.
Like I said, I saw 4 or 5 neurologists before. Everyone was with me for 10 minutes, and then they tell you what you have, and you kind of get pushed out of the room and, give me my next client. I've been with Dr. Kutcher 4 times. I've never been with him for less than an hour. He's with me, just me, the entire time. He's not in it for a business deal, sort of, you know what I mean? Is what it's like. He wants me to play. I say thank you to him every day for it. The first day I walked in, I was so thankful that I even got the meeting. I told you I I emailed him on a Friday night. You email a doctor on a Friday night at 6 p.m., you hear back 3.5 weeks later. He wrote me back in 20 minutes, and he met with me as soon as he got back. He's not walking in and saying, oh, here, you gotta fill out this form, and you gotta pay this, and you gotta pay this. He's walking in and saying, okay, so when was your last game? When's the end of the season? What can we do? We need to make sure you're safe, but let's start going here. Let's try to get you back. And he's obviously got all these different rehab programs that work because they've worked in the past, and it's not a sham.